Our SSM project focuses on the role of acupuncture as a mode of alternative medicine in cancer care. These are the main points I will talk about. The practice of acupuncture dates back to more than 2,000 years ago and is believed to have originated in China. In 1997, the NIH at a consensus conference defined acupuncture as a family of procedures involving the stimulation of anatomic locations on the skin by a variety of techniques, often by penetration of the skin by needles, which are manipulated manually or by electrical stimulation. In practice, the most widely used methods are needles and moxibustion, which is the burning of a special incense. The way acupuncture works is directed by Chinese medicine theories, which is why I will go over the important principles here briefly. Qi and Xue are the vital energies that flow through living things, including our bodies. Yin-yang are two natural opposing forces. They govern the balance in all things in the universe. The 5 elements, Wu Xing, form the building blocks of all matter. The interesting thing about the 5 elements is that they can complement one another, but at the same time vanquish one another. Jingluo are the meridians that run through our bodies and circulate qi, maintaining communication between our vital organs. Acupuncture is believed to be a way of enhancing the flow of qi along a meridian. According to Chinese medical belief, man's vital organs are Wu Zhuang and Liu Fu. These 2 sets of organs are paired up, and each pair is closely related to one of the 5 elements, Wu Xing, as seen in this diagram. With these principles in mind, how then are they applied to treating disease? 整体观念，辨证论治. We were told this is the central dogma of Chinese medicine. It means the body should be viewed holistically, as a whole rather than a combination of parts. Also, we need to assess not only which part of the body has gone wrong, but the character of the dysfunction in order to find the root of the imbalance. And once the imbalance is treated, the disease will also dissipate. More specifically, by using 四成 techniques to assess 八纲, the proper treatment can be designed to restore balance in the body. Confused? Here's an example of aphthous ulcers, which are ulcers in the mouth. The practitioner observes ulcers in the patient's mouth, then, by 四成, decides that this is a symptom caused by excessive fire in the heart and small intestine. Since the problem is fire, heat cleaning of the heart can be used through a purgative approach. As a means of treatment, the 手少阴心经, which is believed to connect the heart to the surface via the hand, may be stimulated by acupuncture, and in so doing achieve a purgative effect. So, how is this related to cancer? Cancer is actually a group of diseases in which cells that have become abnormal divide uncontrollably and can invade other organs. Besides being a deadly disease, cancer-related symptoms are often a source of great misery to cancer patients. Despite constant improvement in conventional treatment methods, patients often complain of problems that fail to be effectively managed, and the more aggressive treatment modalities like chemotherapy have unpleasant side effects. Among the many cancer-related symptoms, 2 common ones are pain and nausea and vomiting. The question is, could acupuncture offer any help to patients who are suffering from such? In fact, pain relief is a very common application of acupuncture. In Chinese medicine, acupuncture is believed to lower one's sensitivity to pain and increase one's pain threshold. Shown here, these 2 acupuncture points are important points for pain relief, but usually, different points are stimulated according to the source of the pain. The analgesic effect of acupuncture has also received much interest in the Western world. Unfortunately, Though many mechanisms have been proposed to explain the effect, the end picture is still rather complex and ill-defined. Nevertheless, many studies support the efficacy of acupuncture in treating a variety of pain conditions. For cancer pain, we quote here a high-quality randomized controlled trial which was published in the Journal of Clinical Oncology. By using 2 placebo groups against one treatment group receiving auricular acupuncture, which means acupuncture in the ears, the acupuncture group showed a significant reduction in cancer pain. Importantly, these patients had previously suffered pain despite stable medication. As for nausea and vomiting, in Chinese medicine, acupuncture is said to have the effect of preventing worsening of the condition and stopping nausea, and also to boost gastrointestinal function. Western research also agrees with the efficacy of acupuncture in treating nausea and vomiting, as seen in this statement by the NIH and from this Cochrane Systematic Review. By pooling 11 different randomized trials into a meta-analysis, this review demonstrated the effectiveness of acupuncture in reducing the severity of both acute vomiting and acute nausea in cancer patients who were already taking antiemetic drugs. Diagrammatically, you can see that the overall relative risk deviated from 1, indicating a significant reduction in nausea and vomiting severity. Hence, focusing on cancer-related pain and nausea and vomiting, we can see that current research supports the use of acupuncture as an effective means to treat these 2 symptoms. With the added benefits of acupuncture being relatively cheap and simple to operate, we believe that with the growing body of scientific evidence, acupuncture will become an important mode of alternative or complementary medicine for cancer. With such, the quality of life of cancer patients can be improved. Thank you for listening. Our special thanks must go to Professor Tony Mok for his patient guidance and generous teaching that has given us much more exposure than we ever imagined.